Yay, done. So before I start this meeting, I had some great advice from Mayor Bagley, and he said what he would do tonight is to tell everybody in the audience that we just have a ton of cake out there. Go help yourself. Free cake for everybody. So go out there. Woohoo. So the meeting is called to order. I'd now like to call the November 16th, 2021 Longmont City Council study session to order. Could we please start with the roll call?
Mayor Peck.
Here.
Councilmember Yarbrough.
Here.
Councilmember Hidalgo-Fahring.
Here.
Councilmember Martin.
Here.
Councilmember Rodriguez.
Here.
Councilmember Waters.
Here.
Mayor, you have a quorum.
Thank you. Can we stand for the pledge?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I would like to remind you that this meeting can be viewed on the live stream at www.longmontcolorado.gov. Anyone wishing to speak during public invited to be heard may participate by appearing in person and adding their name to the public invited to be heard sign-up sheet outside council chambers prior to the start of the meeting at 7 p.m. Those on the list prior to the start of the meeting will be invited to speak for 3 minutes each on any topic. And I think Dawn is going out to get the list. We'll see who's there. Do I have any motions to direct the city manager to add agenda items to future agendas? Seeing none, we will go right to public invited to be heard. The first person on the list, I just want to remind you that each person has 3-minute limitation per speaker. It looks like we have 2 people. The first person I'd like to call is Mary Lynn. You state your name and your address, please.
My name is Mary Lynn, and I live on Atwood Street in Old Town. Thank you for the opportunity to speak. I would like to speak to the agenda item, I believe it is 4D, speaking about the opt-out issue for smart meters and the need for smart meters in general. It has come to my attention that there is not a consensus that smart meters are actually necessary for home or business energy use reduction, and in fact, there is no evidence that they actually save money in many cases. They are believed by many engineers to be an unnecessary and outdated technology that is rapidly being replaced by things like HERMs and DERMs, home energy resource management systems, and distributive energy resource management systems. They have proven health concerns as recognized by a ruling against the FCC in U.S. Court of Appeals, D.C. Circuit this past August, which opens the door to more lawsuits and restrictions on the use of this technology. So the ability to deploy irradiating and surveillance and energy management devices like smart meters is going to be changing rapidly in this new environment. They are a surveillance technology, and there's no guarantee of where our data will go, and data is personal property protected by the Constitution, and there are many people who simply don't want anyone to be collecting that information. There's also a redundancy issue. You are going to be speaking this evening, I see on the agenda, about the program that the city has been working on with the Smart Thermostat Demonstration Project, which at this time is an opt-in, I understand, and Tim Ellis has been doing a lot of really innovative work looking into appropriate technology in this regard. However, if you have a smart meter, why do you also need the city to be able to reach into your home and turn down your thermostat using the same kind of data collection. It's also a nanny state technology in that there are many ways to ask people to simply turn down their thermostat without having to ennoble the city to do it for you in this way. And the other person in my party will speak about the FCC ruling and more about the health effects that the FCC has now admitted to, and that will be changing the legislative landscape. Thank you for your time.
Thank you. The next speaker is Ben Sargent.
Good evening, Mayor and Council. Thank you.
Oh, they are. I'm sorry. Thank you for pointing that out. Do you have a mask, sir? Thank you.
Okay, my name is Ben Sargent. I live at 744 Atwood Street in Longmont. And theoretical question, but I wonder why the city needs to lie about things. I had a very lengthy conversation with a gentleman at the water department about replacing our water meter, and was assured that it would not be a smart meter. But come to find out once it was installed that it was in fact an AMA smart meter that was installed. We were told that the transmission of data would be only during a drive-by, and it was equivalent of a garage door opener. When we measured it with a meter, we were getting 2 pulses per second, which is at the high end, that's 190,000 pulses per day. This is something that's deleterious to human and other biological life forms, and should not be anywhere near my house. So I resent the fact that I was lied into agreeing to it, and I would like somebody on city council to take this up with me later. Meanwhile, there was a recent court case, the previous speaker mentioned it as well, that was decided in September and August. The issue is that the rollout of smart meters is based on the assumption that they're safe. And if they're not safe, then the rollout is can be considered capricious, arbitrary, and not evidence-based. And that is in fact what just happened. So the FCC admitted in August that that the guidelines were not based on safety, and the U.S. Court of Appeals in September then made a decision based on that. So I think that the field has just changed, and the city should look into whether there's a significant liability issue now with smart meters. So the issues is pulsed radiation that transmit the electrical usage to the utility companies and communicate with other meters, and can be picked up by a house's
I'm sorry,
copper
your time
wires
is up, sir. Thank you very much.
and used as an antenna.
Thank you. Seeing no one else, I'll close the public invited to be heard. We're going to have a special report. So are we ready for the Smart Energy Provider Award? Doesn't say that. Do you have a COVID update for us, Harold?
I do, Mayor. If you would like to go ahead and go with the awards, I can definitely do the COVID update after that.
Okay, that would be great. So who is doing the special awards? The Smart Energy Provider Award.
Yeah.
Somebody gonna bring up that, I had a couple slides.
I just wanted to double check.
Which one is it?
This one. Good evening, Mayor and members of the City Council. My name is Chuck Finleon. I work in the Energy Strategy and Solutions Group within LPC, Longmont Power and Communications. I'm here tonight to briefly tell you about a couple awards that we applied for earlier in 2021 and were subsequently awarded in October of this year. The first of which was a Soul Smart Award. For those of you who've been around for a while, you know that Soul Smart Awards aren't new to the city. We actually, I'll talk a little bit more about that. To give you a little background on the Soul Smart Awards, they're funded by the Department of Energy, and they're actually, the whole program is really to encourage communities to become more solar friendly, make it easier for people if they want to put solar on their home or business to do so. Okay. What's wrong here? Did that work, Gerald?
No.
I'm stuck. How'd you do that?
I just clicked it.
Alrighty then, I guess my hand's not working right. So obviously with both of these awards, there are criteria that they exit the point-based system. You need so many points to qualify for each award. We were actually awarded the Soul Smart Bronze Award in 2017. And that award was really for laying the groundwork for that program. It was a lot of administrative things, putting like checklists and stuff on our website that people could easily follow in order to get solar installed on their home or business. In October of 2020, we actually received the Soul Smart Silver. That was actually going a little more in depth on those, on the administrative stuff, training people. And then the Soul Smart Gold, which I actually have a plaque here, is actually when we went in and changed. We actually went in and we changed the changed ordinances and stuff to make it like we committed to a 3-day or less turnaround on solar permitting. And then there was some changes we made to our website as well. So the gold is obviously the highest level you can get. So we hope to continue this process, but you can see the graph below on the screen is actually, in 2016, you can see a sharp jump. We actually started, in 2016, there was a little less than 100 solar PV systems in the city of Colorado, of Longmont. And today, there's about 525. So hopefully our program is helping that curve go up. I think technology is helping it as well. And obviously cost of solar is going down, so that's a good thing as well. And then special recognition as part of this award, I'd like to recognize Joan Marsh for her continued process improvement efforts associated with these awards. And Lutz, who is my boss, for continued pursuit of the Soul Smart Awards. Blas Hernandez and Ozzy Taryn for permitting and zoning revisions that were required, especially for this particular award. Scott Roche for updates to our website, and Tim Ellis, who is not here. He no longer works for Longmont Power and Communications. He took a job somewhere else, but for his work on working with all divisions to make this possible. So that's the first award. The second award, like the first one, is not a new thing to the city of Longmont. Smart Energy Provider Awards are actually awarded by the American Public Power Association to public power utilities that can demonstrate a commitment to energy efficiency, distributed generation, renewable energy, and environmental initiatives. That sounds like a lot. I know the city is just embarking on a lot of that right now, but so we hope to keep continuing our efforts on that and get more points. The point-based system, it's you have to have at least 70 points. We scored 87. Hopefully, as we progress down the distributed energy resources and a lot of the renewable stuff, that'll go up even more. But it's a 2-year designation, and like the other award, there's designation criteria, and this one is, like I said before, it's a point-based system, and it just depends on, they rank you on how you're doing in each one of the categories. A lot of the stuff, this isn't just LPC that is involved in this program. It's obviously, they take into account the stuff that the city is doing from a environmental perspective, sustainability, a lot of that stuff. It also takes into account our energy mix from Platte River Power Authority, and then just a lot of the stuff we're doing in-house within LPC. So that award is right here. Both of these awards are actually in the service center. So that's all I had, if there's not any questions. Thank you.
Who is seated?
All right.
Actually, I would like to say congratulations to the whole staff. This is amazing, and it proves how hard you're working to get this city to where we want to go, to our goals of 100% renewable, of the technology we need in our community in order to reach those goals. And these are amazing awards, and I commend to all of you. It's amazing. Thank you very much.
Thank you.
I trust Trina and Kate, so that's good news.
That's okay. We're here.
Yep, there we go. Okay, ready? 1, 2, 3. Your eyes can tell you're smiling.
Wait, I wasn't smiling.
Thank you very much. Not at all. Not at all. So now, Harold, are you ready to give us a COVID update?
I'm ready now.
Thank you.
Mayor, Council, wanted to start off with Lexi Nolan and the staff at Boulder County Health wanted me to express their sincere apologies for not being here tonight. We had a scheduling issue, and based on that, I went over their presentation with them today during the administrative meeting. She sent that to me so I can go over it with you all. But Lexi and the director, Camille Rodriguez, wanted me to extend to you all that they're willing to schedule a Q&A session with the city council in the next few days based on your availability if you're interested in doing that, so you can ask them questions as we move forward. So if you all will think about that, and then when we get to the end of the presentation, we'll try to see what we can do to work with them. Talk to Eugene. I think we found a way where we can make sure we can get it posted and do everything appropriately. But again, wanted me to express her sincere apologies for this. You know, to be honest, right now, when you look at just the volume of work and where they are staffing, they're really dealing with a lot of issues. So I'm going to try to do Lexi justice in this presentation. And these are many things that she and I talked about today. And so I have to use readers, and they're fogging up on me right now. So again, I will apologize if I have a hitch in this. So when you look at this, in terms of the goals, is preventing severe illness and death as they're looking at this. And really what we're finding is that transmission is lower in Boulder County than the surrounding counties. But we have seen an unusual number of deaths over the past week and anytime over the past 6 weeks. And you'll see this later in the slides. Anytime we talk about this, it's extremely tragic. And I can say that all of the folks on the admin call really are watching this. But the reality is that death rate is still much lower in Colorado than the U.S., and it's still lower in Boulder County than it is in the rest of the state. When we talk about not overwhelming the healthcare system, this is a really big topic of conversation, and you'll see some slides later. The hospitals are moving to crisis standards of care, and what we mean by that is they're triaging illnesses. There's some rationing. There's very few med-surg available, ICU beds. Obviously, we've talked about the staffing and stressors. And really, it's just that point where they're having different conversations in the admin, and you'll hear me talk about this probably again later. Not only are they reducing the procedures that they're doing in terms of the elective, what's the term, Sandy? The elective cosmetic surgery. They're actually starting to delay other procedures in this. And when they talked about this, well, I'll get into that later, but generally it's also people put off healthcare last year when things are surging, and so it's a number of things, the confluence is really coming together. And so the deferred care, they're also worried about the flu, and then when we look at school returning safely, they are seeing school quarantines down from last year. There is the voluntary vaccination program that's in place that offers choices for the business community, and they're seeing a number of businesses participate in that, and then advising to wear a mask. The key messages that they're really talking about is that we're still in surge. We're doing better than the other counties. Right now, 1 in 48 Coloradans are infectious. We talked about the strain on the healthcare system. They're currently projecting the cases to peak in early December and hospitalizations in mid-December, but again, they're still really watching what the caseloads are doing. There is some optimism in the system in that 5 to 11 group booster and booster vaccines, they're really seeing more uptake in that, and so that's good news as they continue to move forward. But they're really saying probably January is what they're expecting in terms of this trend to move forward. This was a really interesting slide for me because when we talked about it today in the administrators meeting, if you look at this in comparison to the U.S. states and the 7-day incidence per 100,000, you can see where Colorado is in terms of the other 50 states. That's unusual in terms of where we are. We have typically always been at mid to lower end of the scale. If you look at the one arrow where Colorado was a month ago, and then you can see where Boulder County is today, obviously you all are asking the same questions. What's happening here? What's really going on? The answer is they're not really clear. And so this is being studied by CDPHE and a number of researchers. Basically what they said, it's not clear, and they think it's a combination of all of these factors, of cooler weather, kids going back into school, the normal activities in the large gatherings, which is ultimately the decrease in transmission control. And then when you look at the effectiveness is lower for 80+ individuals. And so this was pretty interesting for us to see that you have a 90+% protection from cases for those under 80 years and 65% for those over 80. And then obviously on hospitalizations moving in the same trend. But then the other thing that has to come into play is where are other states in terms of the number of tests that they're producing and people are going through. So if they're not generating a lot of tests, it's hard to really understand what is happening in those states. And we know that we do tend to test higher in Colorado and in Boulder County than some areas. Currently our 7-day average is 253.1. You know, today in the conversation there was some optimism by the downward trend that they're seeing, but obviously if you just look at the way the numbers have been moving historically, we tend to go down and then we tend to pop up. When we see that more elongated decrease is when it's more gradual over time. This may actually differ than some of the numbers that you're seeing from the CDC, and because of delays in reporting. So sometimes if you go to the CDC site and you go to their site, there may be differences. It's a reporting issue that's occurring in that they're able to pull the numbers down directly from the state system. Again, just another look at this. You can see that people are continuing to move around in different locations, but generally we continue as a state to move up, which is unfortunate. And then when we look at this, obviously the 0 to 11-year-old category, and what they're really seeing is probably 5 to 11 when you dig into this number. They are starting to trend down, but similar to what we said earlier, we're hoping that we continue in this trajectory and we don't continue to do the up and down that we've been seeing recently. And then when we get into Boulder County, and this is an interesting slide, so obviously we were seeing it more in line with the population before, and now we're starting to see some disparity in the Latinx population. Now, I want to talk a little bit about this. When you see the 26% here, we also have to put that in reference to what we're seeing in Longmont, and I'll talk a little bit about that because we're on the same trend. And so if we tend to be a larger percentage of the cases in Longmont, it does make sense that we're probably seeing a higher number of cases in the Latinx population because the Latinx population in Longmont is higher when you just look at our community versus when you look at it on the county-wide level. We have more people in the Latinx population than Boulder, and we're also seeing the growth in cases. And so that's the nuance in this, and so they're obviously going to continue watching this. We've asked for some additional data on this, and you've heard me talk about this. When we talk about the staffing issues, they're really just struggling right now in being able to generate what they're required to generate based on staffing and some other issues. They have got a lot of work on them. So when you look at this, and you look at 43% of the cases in Longmont, 23% in Boulder last week, and talking to them this morning, there's a nuance to this. In that, not a nuance, there's an interesting piece. So we obviously don't see Erie called out in this graph. And so my question to them was, well, what are you seeing in the other cities that border other counties? And they are seeing a difference in the numbers in that we tend to be higher if you're on the eastern side of the county or if you're on the northern side of the county. And so specifically what they talked about in the admin meeting was that Erie, Longmont, Lyons, they're seeing a higher number of cases than some of the communities are that are on the southern end of the county or more central to the county. So there's definitely a connection point, which is why when then you see the 43% here and then you look our percentage of the Latinx population, how it may look different in terms of the county piece. Based on what they said, and again, I'm just repeating what they talked about today, so it really is when you're close to another county that doesn't have the same requirements and restrictions. There, and Lexi was going to talk about this, and she can probably go into more detail. Really is, directly impacting the numbers in those communities that are in those areas when you can literally go just, in Erie's case, across the street potentially. They did put in additional rules, but you can still go not that far, and you're in a completely different set of requirements. 7-day positivity, we're seeing that decline again. It really is understanding how many tests, what are we seeing higher test rates, but this was probably the most sobering piece of information. So there have been 39 deaths since May of 2021. Among the 39 deaths since May, 53.8% are female, 82.1% are white, non-Hispanic, and the average is 76 years old. 181 or 61% of those deaths are among Boulder County residents, have been among those associated with long-term care facilities, but the pattern's changed, and you can see the pattern changing in this. And that when you look at where we were earlier this year and then in December and where we are now, you're seeing the majority of the deaths actually are not associated with long-term care facilities. So health and epidemiological capacity, and I think this is going to answer some of your questions. You can obviously see in terms of the epi tracing well beyond the capacity of the health department to do what they need to. Hold on, now I'm off. This was another series of slides that, so you have less than 1,000 beds open across the state, less than 80 open ICU beds, and this is time sensitive too. It could very well change tomorrow. They're expecting 15,000 more COVID hospitalizations and 2,000 deaths by the end of February, and the state has actually been engaging in some of the recent actions, and we'll have some of that on slides, and then we'll talk about where Boulder County really sees where they will be in the near future. North Central region continuing to trend in the same direction, really at that 7%. Staffing shortages are holding, and pediatric confirmed cases. So currently, I know this is one of the questions that you all had. We have 98 people hospitalized with COVID-19 in Boulder County. To put that in perspective, and when you look at this chart, look at how close the spike is to where we were at the end of November and December in terms of those hospitalized. Now, what we don't know, because we obviously talked about the state system shifting in terms of where they are in care and having to manage and transferring people. We don't know how many of those hospitalized in Boulder County are Boulder County residents. I asked that question earlier, and they just don't have that data at this point. But even then, we were in a similar spot at the end of November, beginning of December. And the next slide, based on timing, you can kind of see where we are in terms of staffed ICU beds available in Boulder County, and we're currently at 10 that are available. So again, continuing to see the pressures that are being placed on the medical community and the crisis standards of care and what they're looking at. They actually, if you looked at one of the slides, they moved to level 3 and what they're having to deal with. So what's the state doing? They have requested the med-surg teams, obviously delayed cosmetic surgeries, crisis standards of care. I think I got a hold of myself. Patient admission and transfer orders. They're not requiring patient consent now when they're transferring individuals. They are working on a distribution model for the monoclonal antibodies. They're in short supply right now, but they are looking at how to do that in some of the more urgent care facilities. And they've issued some advisories, and obviously you can see the case-by-case issue. So here's the good news. When you look at where we are in terms of vaccine uptake and where we sit, one of the things that was interesting is they did see a 1,500 jump in people being vaccinated this week. And so that was probably one of the largest increases they've seen in a while. But this gives you a sense in terms of what we're looking at across the different populations. This number is a little bit different. Remember when we looked at percent of eligible population, we were around 80%. Well, we just expanded the eligible population when kids have been allowed to be vaccinated. So you saw it shift based on that additional number that we're bringing into it. And so they really hope to see these numbers over time continue to increase based on more and more of the younger population being vaccinated. And this is what it looks like in terms of boosters, and so we are seeing a lot of booster uptake in Boulder County. And this is kind of what you can see in what they're doing. So obviously on Thursdays in Longmont, they're doing the 12 plus equity clinics. You can see their goals in terms of 5 to 11, and then really focusing on some of the, oops, my hands got off. So the equity clinic at the Longmont Hub on Thursdays, and you can see what their goals are setting for 5 to 11. And then obviously still focusing on the school equity clinics. They are partnering with both BVSD and SVVSD on doing that, and then really the education component on all of this. So Boulder County, obviously they did an advisory recently on the surge conditions. The fact that an advisory on hospitals nearing capacity. They're recommending to move gatherings outdoors, recommending masking outdoors in large crowds, and you can see the universal masking order and the school masking order. The business team, they are doing enforcement, and so you all will, I think there's a couple of cases that are probably going to be filed this week on people who are not complying with the masking order. And then, so what are other people doing? So Denver has a vaccine requirement via public health order. There's different versions of municipal vaccine requirements. So on this, you can see that Boulder County and the city of Boulder, they both are actually requiring vaccines for their staff members. In the case of Longmont, what we're saying is that if you're not vaccinated, you do have to test once a week, really kind of following the federal guidance that we have. Erie's doing something similar as well. And then we still have the school mask requirement. Federal actions, you can see all of these. And so when we look at the employers with 100 plus, this was an interesting one because when we looked at our contracts, there was an original question for us is, can we require our contractors to do this? And originally it's, well, we have an existing contract, we can't really augment it. But the interesting part is that in our contracts, we do require them to meet OSHA standards. And because this is an OSHA standard, our contractors that have over 100 plus employees have to meet the standard. And so we'll be working through that. The federal workforce, the federal contractor provision, that's interesting to see because we think that really can touch us in different ways based on the contracts that we have. And so then when you look at some of the legal challenges, I was just sharing this with Eugene. This is probably more questions for Lexi and the team, but I wanted to give you an update. The Jefferson County mask mandate has been upheld by district court against religious challenges. Douglas County should not permit a personal exemption to mask requirement schools because it violates rights of ADA students. This was really the interesting piece for us. And what they're seeing at the county level is it's largely unsuccessful on religious, unconstitutional grounds. The Supreme Court piece, obviously Eugene will have to look at it, but at least what the county's telling us, they've upheld the New York City teacher mandate, the Indiana University mandate, and the Maine healthcare work mandate. And then the Fifth Circuit, or was it the First Circuit, has said that there's no constitutional requirement for a religious accommodation in some of those. I'm not going to go much into detail other than say this is what they're seeing. That's really questions for the county to answer. And that is the last slide. So I would be happy. I do have the other slides. I just don't think I downloaded it and in the craziness of getting this one, but the one with the wastewater and the other stuff. Do you mind to see if you can bring that up? While Sandy's doing that, we will.
Looks like Councilman Waters has a question. Dawn, it's not letting me say mic on. There it went.
Thanks, Mayor Peck. My question really is not of Harold, it's of us. We've been in this conversation now at least 2 other times about meeting here with masks on or meeting virtually. The last time we were in the conversation about meeting here with masks on, part of the concern raised by Councilmember Martin was for those people who need to, or at least benefit from seeing one's lips, right, along with hearing someone's, or not, someone's voice. And the difficulty that presents for people, even who are here, with hearing problems. Personally, I'm on record with what I think about where we should be meeting. The last time we talked about this and voted on it, there was some discussion about the kind of example we want to set. And I said then, I think the example we ought to set is an abundance of caution. We chose to set a different example. I think it's time for us to re-examine the kind of example we want to be setting as a council. We could, if to sit here with masks on, to have everybody who's here with masks on, when we could be equally as productive and set a different example in terms of what we need to do to get beyond this, seems to me a responsibility we ought to own. And the question really is, at what point in time, what data do we have to see before we say that we need to go back to meeting virtually until we see the trends get back to where they were in June when we decided to meet in person? Because since then, it's been nothing but bad news that I can see in terms of the data. So it's a question. I'm not making a motion. Where I stand on this is not a curiosity to anybody, or a surprise to anybody. But we sit here week after week, look at the same trend, and then just continue on. And I guess, hope for the best. Good work's being done with vaccinations and testing. I'm not being critical of any of that. I just think we ought to be setting a different example and reducing any risks that we're creating for our staff and being here with masks on. So, my comments.
Thank you, Councilman Waters. Let's see, Councilwoman Hidalgo-Fahring.
Thank you, Mayor. I'd like to respond to that. Initially, I was one of the people who supported in having in-person, primarily to give our residents the opportunity to come in, have that face-to-face conversation with us. There is something to be said for having those in-person connections. And while we were doing it, I am appreciative of it. But, I look at, especially as a third grade teacher, I see those 0 to 11 numbers just going up. And it has made me reevaluate, rethink things. Are we making the best decision? Are we making the most responsible and careful decision by continuing to meet in person when these numbers keep going up? Last week when I had asked, what is the criteria? What is that? Initially we had said, well, we're going to follow CDC, we're going to follow Boulder County, the state. And I'll be honest, I'm very frustrated with them. I'm very frustrated that they haven't said, okay, this is the criteria it takes to shut a place down. I'm hearing a lot of mixed messages, and one of the things, and I talked to Harold about this earlier, is, it could be that people are interpreting these regulations differently. So then what's being kind of disseminated out is contrary. I do want to revisit this. I want to make sure that we are not putting folks unnecessarily in harm's way, especially as we get into more controversial topics, I think, in our agenda, where it would require a lot of people, wanting to come in and voice their concerns. That those things have me concerned as well. So, I'd be open to reconsider and have a further dialogue about this as well. And yeah, next week or when the Boulder County comes, I really want to see what is there hard to say, okay, we're all going online. And that's, is that ever going to happen? I don't know. And so is it up to us to be the ones to make those decisions?
Harold, would you like to comment on that?
Yeah, so in terms of, I think honestly this is the question for the county health departments, and it's also the question that municipalities are asking. And in terms of what I'm hearing from Boulder County right now is, to kind of take you back in time, they were probably one of the first counties that had the indoor masking requirement, and then gradually folks began adopting that. And even those that have adopted, enforcement's a different issue. I don't think they're considering anything right now from a county component. What they did want me to relay is really there's not sure what the state's going to do in this, and obviously Sunday night an order got dropped based on the 500 unseated events have to have a vaccine requirement. But then what's interesting, and I sent something to Eugene and Sandy because I haven't had time to really look at the order, but there's a lot of, in the state's order, we strongly encourage the municipalities and county governments to institute a vaccine requirement and or a testing requirement. And so, and those things, most of those we've already done. And so there was a lot of strongly encourage cities and counties to do things, but they're not putting any of the requirements in there. And it really gets into the space of what we talked about earlier, is when you have a county with this set of rules and a county that doesn't have the rules, and kind of what's starting to happen. And I think you're seeing that in certain cases. So it doesn't appear that the county's going to do anything. I know that they were in conversations with the state today and trying to get a broader statewide approach, but we were both equally frustrated when we read some of the orders, and it's the devolution of cities and counties, you need to do this, but then we're all in different spots, which then makes implementation and operation very difficult, because then you actually start taking the businesses in your community and putting them at a competitive disadvantage, because then if they have to do certain things, people then will go to other places where they don't, and then that creates a different issue. And so we're as frustrated in this as anyone, and I will say that the county's as frustrated in this, because I think we do need that broader statewide look at this.
And then, I'm sorry, one more thing really quick. So one more comment. So, I think that if we, as an operation, so if we meet online, it's not going to cut our business. I think about businesses that would have to close down or have to, go back to where we were last year. For operations like ours to go back virtually, it minimizes that person-to-person contact, but it still kind of makes room. Do you understand what I mean? Like, it kind of makes room for businesses to keep their operations going as much as we can, while doing what we can to kind of minimize person-to-person contact. So, just something to think about. Thanks.
Councilwoman Martin.
I don't have to push that anymore. There you go. So I want to just make another remark. And Harold, can you remind me the opportunity for us to have a conversation with the Boulder County Health is going to be when?
They said they would be willing to look at it tomorrow night or Thursday night. They really want to see what availability is for you all, and they'll work to get that set. So if you all can give us some times when you're available in the next few days, they said they'll work to try to accommodate schedules.
Okay, so we shouldn't make a decision before we've had the conversation. But I would like to point out something, which is that the original reason for staying in person, despite the ADA problems and despite the risk, was so that we could have more face-to-face eye contact with the public. Well, look behind you, folks. There's nobody here present, few people, yeah. And I know I yelled at you right before the meeting, Dale, but yeah, there's some people here, but the public as a group aren't coming, and they weren't here last time, even though we had a big festive, first council meeting of the new council and everything, only really invested people were here. And the speakers that we had left immediately after public invited to be heard. All they wanted was to be heard. They didn't want to participate in the council meeting in any way. So let's just keep that in mind. We could be online for the next several months. We could start planning now, and I think the open forums are really important. But we could make plans to have that happen in Stewart Auditorium, with distancing and the public masks, but we could be on the stage and not have to have masks on, and, and make that an exceptional event, which it is or ought to be anyway. But I would really probably like to say when our numbers are like this, I feel safer at home.
So to be fair to Boulder County Public Health, I know you mentioned until you talk to them, I've probed. I'm not sure they would say, we recommend this or this. They're gonna say, that is your decision as a body that you need to make based on the data. I just wanna be fair to them that if you're trying to get that, they're probably gonna hedge in a similar way that we as staff hedge to say that's really your policy decision.
Yeah, and I turned off my microphone too soon, but I wasn't expecting that. I just thought they could answer good questions.
Okay.
So, first of all, I guess council needs to decide, do we want to have a Q&A with Boulder County? And if you want to discuss it for a couple minutes, not a long discussion, just ring in and you can have the mic. Or, all those in favor, say aye. All those opposed? So I guess we do want to have a Q&A with Boulder County. So I suggest we email our times that we're available to Sandy? Okay. And I would suggest also that after we have that Q&A and the next COVID update, that then we decide as a council, do we want to make a hard decision? Do we want to go virtual again, or do we want to stay online, in person? Because it is our decision. So does that sound like a good idea to everybody? We'll have the Q&A, and then at the next meeting, which should be hopefully the 30th, we can decide at that point, virtual or live, depending upon the data again. Hopefully it'll plunge.
So
Okay.
I have a couple more slides that you all typically ask for. One
Okay.
is an answer. So this is our wastewater data. So you can see the trend.
Yeah,
So
it's
while
not
there's
good.
spikes, what I'm looking at is a curve, the general curve, and that curve is just lining up spot on with what we're seeing from a case basis. And you can kind of look at what we can expect in the next few days based on the wastewater data that we're seeing now. And then this was the other thing in terms, the state just put this up in terms of vaccine breakthrough information. And I think it's interesting when you look at vaccinated cases per 100,000 for 7 days, 162.7 versus 601 for unvaccinated. 4.6 hospitalizations versus 43.7, 23.2 deaths versus 288.9. This was the information that I believe council was asking for. Obviously, this is a state look, but typically what we see are the trends tend to just follow through all the way down to the county level. So we wanted, this is the website where you can see the real-time data on the state side.
Can you put that back up real fast?
Yep.
I didn't get to write it. The website.
We'll send it to you via email.
Oh, perfect. Thank you.
Yeah, it's a brand new. It just came out. So.
Okay, good. Good. Okay, is that it, Harold,
That's
for
it.
you? Okay, we are next going to, oh, sure. Sorry, I didn't see you on.
Thanks, Mayor Peck. Harold, go back, just back one slide to the wastewater data. Or wastewater slide. So, so on what the peak, give me an idea of what day we're talking about. Is that November 10th, 11th? Because I can see it dropped to on the 15th or 16th. Just give me, and the follow-on question is, whoops.
Friday.
The peak is Friday, or
Looks like the peak is Friday.
was last Friday.
Yeah.
So now remind me, this is a leading indicator. What's our time frame between this as an indicator of what we're going to see in terms of an increased number of
7 days. 5.
5 days? 7 days. So we should anticipate that spike showing up at the end of the week, right? So what we've looked at, that's a little alarming when we look at that number, that by the end of this week, we're looking at the highest number since in a year.
I think that's the highest number. Go ahead, Dale.
It's higher than any number in November of 2020.
If I could just real quick, Mayor Peck and Councilmember Waters, you know, I'm glad you're looking at this.
Thank you.
When I look at it, I just look at the trend.
Yeah.
I don't concern myself necessarily with any single day, because that can be
Sure.
that can be a sampling error, that can be anything. The trend is clear, and you're right. We are, I think, in a sea of virus right now.
Yeah.
In the community. What we're not seeing necessarily is the same level of caseloads, likely because of high levels of vaccination. That doesn't mean the virus isn't here, though.
Yeah.
So, you know, the wastewater data doesn't, it's fairly accurate. And it's telling you nothing more than the existence of the virus in the community. How that then translates into caseloads and hospitalizations, you know, that's another level of inquiry, but
Yeah.
The loading is concerning.
Yeah.
In the sense that you would think at some point we would start to see.
I understand. There's
like,
a whole-
like we saw back in June.
There's a bunch of unanswered questions. You know, how many of these, what does this reflect? Doesn't reflect anything about vaccinations and what percentage of
You'd have to roll that all
Yeah,
into
yeah,
the
yeah.
analysis. Yeah.
It just is, it's alarming,
So
this spike, given everything we've talked about. And how it relates, it'd be interesting to see the new dashboard that you put up, the next slide, what that looks like 10 days out from now, right, to start to do those kind of correlations, right? But back to our conversation of a few minutes ago, this sure doesn't look like it's getting any better, even with the percentages of the population vaccinated.
Thank you for asking that question, Councilor Waters, because it made me think of another one really fast. Harold, do you think the spike in the wastewater could possibly mean that we have a lot of people, even though vaccinated, could be carriers? Has that been discussed at all?
I think that's a hard one to answer
Okay.
because this is just showing the viral loading that's in the system, and I'm going to probably ask Dale to come back up. I think one of the things that we know that was consistent with Delta is the viral loading tended to be higher in the Delta variant versus some of the other variants. I need him to try to, he's more in the detail on that one than I am.
So again, not being an epidemiologist, but what it tells me is we're not seeing the same level of caseload,
Right.
likely because of the vaccination level.
Correct.
You know, Longmont has done very well on getting people vaccinated. You can be vaccinated, though, and still contract the virus.
Exactly.
You may be asymptomatic, or you may have very minor symptoms to a point where you don't even necessarily go get tested to identify it as a positive case. All I know is the total loading of the virus is growing, is increasing, which they're a heck of a creature. They'll probably outlive all of us on the planet. But I think the only thing that's keeping us from having even greater hospitalizations is the vaccination level,
Definitely.
and how important that is to maintaining community and public health.
If you look, the blue lines, I think, are cases in this. And so look at the viral loading versus cases today versus where it was before. And you're definitely seeing more cases at similar viral loading levels, which really is kind of getting at what we're just talking about. Now, what you don't know is what kind of events did you have in your community, how many people traveled into your
Correct.
community from different places, and all of those things can impact this. So that's a hard question to answer.
Okay, thank you anyway for trying.
Yeah, I know.
So we are going to go on to the study session items, but before they do that, I would like to read to council from our general discussion and rule number 4 of our rules of procedure. It's called limitation on debates. What I want to do, because of our discussion of reducing the number of meetings that we have a month, that I would like our meetings to be more concise and tighter. So I'm just going to read this. A member of council shall be permitted to speak only once on the subject under discussion, limited to the matter at hand, until all other members of the council desire to speak having been heard. We already know this. We speak once on the issue and then we can speak a second time. The chair or the mayor may set a time limit on any such discussion of members of council. So COVID excluded, because it is an incredibly important discussion for us to have, I am going to set the first discussion time limit at 5 minutes. And the second time we speak, that's for all of us, on the same issue will be 3 minutes. So let's see how that works. So for example, our first study session item is Building Energy Benchmarking 2021, fourth quarter update. If any of us want to speak on that, the first time you speak on it, you can speak for 5 minutes, and then the second time for 3 minutes. Let's see how that works out so that we can put a limitation on it.
Each.
Yes. Yes, each person. I'm sorry, I probably didn't make that clear. Are we all okay with that? Okay.
Mayor Peck, I was just going to clarify. The study session item tonight is Advanced Meter Infrastructure Electric Meter Opt-out Program. I'm wondering if the title is incorrect on your script.
You know, I think that my is different than the
I believe
script.
that is incorrect. My apologies.
So if I can get this back, I will go back to the,
If you can,
there we go. Get back to my live meeting. So I will go by this. Sorry, it isn't working very well here. You're right. It is, according to the live meeting, it is the Advanced Meter Infrastructure Electric Meter Opt-out Program, which is different than this. So, okay, we're ready for that presentation.
Thank you, Mayor Peck and council members. I'm Mike Valpando, the electric AMI meter manager. We previously talked about what the AMI system is and how it works. Today we want to talk about the opt-out program. So in general, it's about our AMI program will replace as many of the electric meters in the system as we can, the majority of them. But we also want to offer a opt-out program for those customers who may not want an advanced meter, electric meter in their meter socket. So, and I'd like to maybe overview a little bit of the AMI system in general and then talk about the opt-out program. And then we'll talk a little bit about the enhanced services available for those who choose not to opt out. The majority of the customers, they will have an advanced meter. And then the benefit comparison of those who choose to remain in the AMI program, and then those compared to those who choose to opt out. So the program is planning on replacing all 46,000 electric meters in the system. And that's the best way to get full advantage of an AMI system is has the vast majority of the electric meters replaced with advanced meter. Most of the electric meters in the Longmont system are very old, decades and decades old. Electromechanical meters, they have a disk that spins, that type of thing. Advanced meters are solid state, electronic, and AMI meters are in fact communicating meters. They communicate with the head end system, with our billing system automatically over the air. Whereas a mechanical meter, we got to go there once a month and read the meter and then get back to the office and input the data. Everything about an AMI system is automatic. AMI system, we like to talk about the information and activities that we'll be presenting to the public, customers about how the AMI system works and what the advantages are and everything that comes with an AMI system. It's much more capable than a mechanical meter that just doesn't do much of anything but measure the energy. As far as, in this context, a non-AMI, a non-wireless meter is the old meter. Non-wireless, the AMI meter is the wireless meter that communicates wirelessly. And then those that choose to opt out will have the non-wireless meter installed. And then part of the opt-out program is looking at what it costs to continue to read a non-AMI meter, sending someone there monthly to get a read. Those kinds of things will affect the cost of the system. We got to continue to go out and read a certain amount of meters manually that we wouldn't have to do, and process that data. So a person goes out and grabs the meter read, brings it back to the office, we process it manually, enter it, and that kind of thing. A different kind of a system than an automatic AMI system would do. Here we're showing a kind of a dashboard of what a customer with an AMI meter would see and the kind of the functions that they would have available to them. Various things. So an AMI meter, we can get data about the energy consumption for a customer more than just once a month. So it'll come in at whatever a customer requests. If they want it twice a month, multiple times a month, that gives us more resolution on how a customer is using energy throughout a month. And with that, it also helps the customer to be able to look at what they're using, how much they used this month compared to last month, this year compared to last year, those kinds of things they'll have access to through the web portal that we'll have available for the AMI system. A bunch of other things that the AMI system brings, power outages for LPC, the AMI system will allow us to respond quicker to a power outage. So a power outage happens in a certain part of town, all those meters there tell us there's an outage here. These customers are affected. We can send our crews out there to go right to the spot where the outage is caused by. It's much quicker than what we have right now. We don't have any visibility into where it is. We wait for a customer to call. I'm out of power, and we see who's all out of power, and then we're able to kind of pinpoint that. But this will automatically map where an outage would be, so it'll really enhance our response times. So this is kind of an overview of the things that are available with an AMI system. On the far left there, you see kind of an illustration about responding to power outages. So those kind of that are served by the power line in the black side where there might be a power outage, those all go out. They're out of power. All those meters respond to us, and they tell us exactly where that power outage is caused by. We got distribution automation, so DA over AMI is part of that response to outages. A distribution automation system is a smart distribution electric system that maybe reconfigures for a power problem. A power line goes down, it'll automatically reconfigure the electric system so that only that section that has a problem will be out, and then all those around them get restored automatically. That's a distribution automation example. Web portal will be available with an AMI system, so customers can go in and look at all the information they want to see about their own usage. Comparing this year to last year, yesterday to today, cold days versus hot days, how they're using energy with different scenarios. Smart street lighting is also part of the AMI system. We could be able to talk to street lighting in the city to where we can change the when the lights come on, when they go off, how bright they are, how dim they are, that kind of thing comes with street lighting and AMI. Interval data, so that's the idea where we can set it up to where if a customer wants more resolution on how they're using energy throughout a month, we can set the interval data to shorter periods of time so they can get a historical graph of how they're using energy throughout a day. And then remote disconnect, so all these meters that we're going to be installing will have the ability to turn them on and off remotely. So, customer moves in, moves out, we can do things without having to go to the meter every time we want to change a customer or turn an account off or turn it on or restart. Customer moves out, moves in. We do all that remotely and automatically through the AMI system. So here's kind of a table about kind of the advantages and what you get with AMI versus what you lose if you choose to opt out. So like I said, easy move in and move out, automatic. With advanced meter, we can turn things on and off from the office and not have to go out there every time a customer moves or chooses to turn off their service. Can't do that with an opt-out customer. Energy consumption details, like we talked about, we can get more information if a customer chooses by the hour, by the day, even tighter resolution if we want to on a customer's energy usage. New rate programs, an opt-out, MI system allows us to do a bunch more tailored rate structure for customers who have use energy in different ways. With an advanced meter, we have the ability to customize their rates. Time of use, so a customer with an advanced meter in may be able to, if they have an electrical charger in their home, they may not want to charge their electric vehicles during peak periods. They might want to put it out, during low usage times where they can where we pay less for energy during low usage times. Prepay is a concept that advanced metering allows. It's the idea where a customer may want to, instead of paying a deposit up front, they may want to go on a prepay program where they pay in advance their however much they think they'll use in that month. They'll pay online for an amount of energy and they watch it, and if they're getting close to using that amount of energy up based on how much they put down, they may want to reload it or just let it turn off and then wait for next time they can make a payment. Net metering, that's what we got now. We got a lot of solar customers who choose to produce energy behind the meter at their home. And then if during times where they got good sun and they're low usage, it'll produce energy back onto the grid. That's really not available with a non-AMI meter. You need to have two registers to measure energy back and forth. And budget billing, that's the idea where a customer may want to levelize their bills over a year. So in the summertime when the air conditioner's going on, they get really high bills. In the wintertime, if they got electric heat, it's really high. If you get an average of that with AMI system, you can levelize a billing. A customer may choose to have the same bill rate, a bill every month, so that they can keep their budget intact. And then AMI system, with the automatic part of it, it reduces the environmental impact. We don't have to roll a truck every time throughout town when something changes on a meter. So those are all kind of not available with a opt-out subscriber. So we worked on kind of the rate, the fees and rates and what it would cost us to serve an opt-out customer. Came up with a number of different scenarios. So we have a table here showing a one-time fee and then a table on recurring costs. So basically a $15 per month recurring cost would cover the meter reading, the manual meter reading, going out there every month to read certain meters manually is a $15 charge per month charge. The $125 and the $50 are different scenarios where if a customer chooses to opt out before we actually put an AMI meter in, then they get a $50 charge. If we've already put an AMI meter in and later a customer chooses to opt out, then we'd have to go there another time and they would get a $125 charge to opt out. Any questions?
Thank you, Mayor Peck. Y'all may have noticed that I don't praise presentations as much as I should probably, but I have to say that I'm really happy that you itemized a whole bunch of use cases of advanced metering infrastructures and the benefits that people could get for them, because we had somebody say that there aren't any benefits, you know, in from the public being invited to be heard. And they said, well, you know, anything that you can do with a smart meter, you can do with a smart thermostat and a smartphone. And it's not correct. You know, you can do some things going through your smart meter or without going through the smart meter. But none of the use cases that you listed here are things that you could do without a smart meter. Yeah. And some of them, I'd just like to take the opportunity, if you could go back to that list, and I'm only going to talk for less than 5 minutes, but that prepay option in particular, I would like to highlight that one, because since everybody has a smartphone, no matter how much trouble they have paying their electric bill, almost everybody has a smartphone. You can set how much you want to spend on electricity, and if you think you're going to be fine, you know, you can set your thermostat at 70 at the beginning of the month, and then it turns out to be a bad month. You know, you're going to get a warning in the middle of the month that you're using your money up too fast, and that allows people who are really on a tight budget to turn their thermostat down to 68 or 67 and wear a sweater, but they don't run out at the end of the month. And in that same month, when it was all snowy and bad, you know, it would be catastrophic for that family to get their electricity to run out in the middle of the month. And you know, we're pretty lenient about that. We certainly were during the pandemic, but that's a huge benefit for people on tight budgets. Yeah. That they aren't going to be blindsided by not being able to pay their electric bill. And all of these things are really useful in that way. And I just want to point out, because you did a great job of listing them, but you didn't tout them as hard as I think you deserve to, because this system is going to do a lot for us. And I just want to make sure that everybody understands that, and that there are things that you can do with this system, not only just for personal services and benefits, but it's also going to help us keep our electric system as reliable as it is today, or even more. And that's pretty, you know, a pretty good achievement. So I just wanted everyone to know that.
Thank you.
Thank you, Councilor. So, oh, I didn't see it. I'm so sorry. It's not allowing me to turn it on. Help. There it went.
Thank you, Mayor Peck. Could you go to the next slide? I just want to make certain I understand. The service installation fee, this is for an opt-out. There's a $50 service installation fee. Does that imply that every resident who opts out is going to get a new meter, but not a smart meter?
That's true. I mean, we looked at a number of different options. We could leave the old electromechanical meter in there, but that's not a good option. The mechanical meter, I mean, they're old. We need to replace them anyway, and the manufacturers do have a non-wireless option with no radio, but it's still electronic. You know, still an advanced meter that'll last decades, but it doesn't have a radio in it, and that satisfies the non-wireless. Is that really this the wireless part that they're opting out of?
So that's the whole radio frequency issue that we hear about, right?
Yep.
So that's eliminated, but there is the requirement for a new meter to be part of the system, but it's wired as opposed to wireless in this case. All right. So if somebody's not opting out, but they're opting in, then there is no charge.
Right.
So
Right.
that's, we've already budgeted for that, assuming or anticipating that everybody would opt in, or we budgeted to opt in, and then that's the way, that's the way we will subsidize, residents will subsidize the cost of opting out and the installation of a new meter. But that $50 is if they do it within the first, 2 weeks. They wait beyond the 2 weeks, that's the $125 fee.
If we in fact do replace the meter with an AMI meter, and they later choose to go with, opt out, then we gotta go back.
Okay, all right. So that fee would be, that $125 charge is to opt in and then to opt out later.
That's true. If
right.
they fail to opt out before we replace the old meter.
So if I opt out from the beginning, then it's a $50 charge plus the $15 a month.
That's true.
All right, just for the sake of information. Eugene, I'm going to switch to a question to our city attorney. And I'm not trying to put you on the spot, and I understand you're loath to give legal advice in public. So I hope I'm not asking you to give legal advice in public. But we've heard this more than once about liabilities in what liabilities cities are exposed to if they move in this direction. Do you have any insights you can share with us or with the public from your experience, from whatever the case law is, on what kinds of liabilities, if any, cities assume or are exposed to with the deployment of a smart metering system?
Mayor and Council, Eugene May, City Attorney. We did look at this issue, I think it was last summer, and looking at initial research, we were not seeing a lot of liability for the AMI programs in other cities. I think that's about all I'll say.
All right, well, the statement gets made, and I just think, I don't want to have it to be left there, that somehow the city, that we are making a decision that exposes the city to liability without an understanding of where the case law is and what the history is here in the kind of responsibility and concerns we're bringing to the decision, both about health and safety, about energy, how we conserve the use of energy and manage the demand on the grid. I'm going to ask one more question about that, and hopefully I'm not within my 5 minutes. But also on the legal side, in terms of the kind of abundance of caution we're bringing to this decision.
Right. I didn't really see many cases where liability arose for a city. And from an operational perspective, I understand that the AMI system is probably a much safer system than the aging meter systems that are in there now, which are reaching end of life.
Thank you. Just one last question. Tell me if I understand this correctly. So I'll just assert it, and then you can tell me that I'm confused. One of the goals we want to achieve with the deployment of this system is our ability to more effectively manage demand on the grid, right? And our rates for every user of the system in Longmont, our rates are set on peak use, whatever that day is in the month of July or whatever month it is. Our rates for the year are set based on peak use. Right?
Our wholesale rates from our supplier, PRPA.
How will this help us reduce peak use, and does it help us reduce peak use?
So, yes, that's the plan, is to help us reduce our peak demand charges. And so this system gives us the visibility to see those peak demands by customer, by neighborhood, by area, town, and by residential, commercial, industrial customers too. I think we're talking about the ability to look at those demands, when are they happening, and then work with the customers on how they can not necessarily use less energy, but move that demand to different times of the day.
And if
we get our peak demand charge from our wholesale supplier.
And if we can do that, the benefit is to every rate payer, commercial or residential in the city. That's part of what I don't want to get lost in this, is that if we could get this right.
Councilor Waters?
Sorry, my time's up?
Yes, sir.
Thank you.
Mayor Pro Tem Rodriguez.
Thank you very much, Mayor Peck. This is just probably a very quick question and answer.
One talking point that we continually hear via email and also from public testimony is that this is an antiquated technology already. Well, I'd imagine, similar to, say, the television set, which has been around for decades and decades, what was the original iteration is nothing like what we know today. I'd imagine they've made advancements in AMI technology since it was first derived, as they say, I think a couple decades ago is what they continually talk about. I imagine the ones today don't look anything like the ones from 20 years ago per se, or if they do, they've still made a lot of advancements. Can you talk a little bit about the current technology and what's available on the market?
So we went out for an RFP and looked at the best technologies, the best deployable technologies. So there may be laboratory experiments where you may have more than just the meters that we'll be using, maybe a computer really at each house. Those are kind of on the cutting edge, maybe, and maybe not even deployable for years in the future. But what we are selecting, what we're looking at, we're recommending the vendor that we are selecting is the best fit, the most advanced that we could find. And we looked at all the systems available, commercially available across the country, and it's the best technology there is.
So what would you say the difference between the first generation of it and the technology that you're looking at procuring? What would you say the advancements made in that time? What would you say those are?
So one of the first technologies in advanced metering was what we called one-way AMR. So you could read a meter, but you couldn't send a command to the meter. The current state, a lot of utilities put in an AMR system, advanced meter reading, and it was a one-way read system. So you'd send a guy in a truck driving by with a receiver, and it would pick up all the meters in the area, and he'd drive through, and that was like a first-generation advanced meter, electronic solid-state meter with a transmitter. It would blip out its read every so often, and a truck would drive by and pick it up, and it was a pretty good system. That's like a first-generation advanced meter. These current systems are two-way radios. You can send information to it, request a read, or send a firmware update, and also get information from the meter automatically. So that's the current best technology, and it's really in the communication system. The meters themselves are electronic solid-state meters. They've got it looks like any other circuit board in the meter, and there's not a whole lot more you can do with that. There is some vendors that are looking at what we call a sample rate, so they can sample the power wave at more frequently, and with that you get maybe some power quality advantages of a future meter, but those are still coming out. They're still developing those.
And so in concept, a lot of the advancements you would say would be like the surrounding technology, the programs that you can run with it, the software capabilities that communicate with it, and that's really where most of the advancements have come, not so much the actual technology itself.
Yeah, the advancements and some of the advantages we talk about here are just things that we are thinking about now. There's things that are going to come out that we haven't even thought of yet that we can do with, a two-way communication and the ability to get multiple reads throughout a day. There's some things operationally that'll help the utility to be more efficient with how we distribute energy.
Well, and I think one of the questions I asked David the other day, so I'm a bit of a tech geek at home, and kind of what does this mean for me, to some of the other questions. And when we first started this, I referenced a platform I knew in AEP where they literally had a box that they would put in your house and it would integrate with your other smart home activities. And I asked David, I go, well, is this going to have that box? And he's like, no, it's really based on integrating it within the existing apps that you have, so like Apple Home and things like that. So you don't need, so how has it technology evolved? It's how it integrates directly within the services that you already have is what I understood David to become to play in this. That's more of the personal kind of user experience.
Dave Hornbacher, Executive Director of Longmont Power and Communications. Very good questions here. You're absolutely right. One of the things that is moving forward on these meters is the embedded technology. And then the tools that are built around that embedded technology, so you can do many of the features that we've talked about here, or we mentioned distribution automation, but it's the tools, it's the app that you will have. It will be how we talked about shaving the peak, but it goes even beyond that, because at some point we're actually looking how to synchronize renewable energy generation and usage. And so if we've got events of high renewable energy generation, you'll be able to look on the system and sort of determine where you can place that energy versus having to essentially offload it elsewhere. And just it's a means of helping our community become more green at a more rapid pace than many other communities.
Thank you.
Are there any more questions from counselors? The second round of questions? All right. Councilwoman Martin.
Thank you, Mayor Peck. Just some information, because, you know, we're sort of on the very verge of getting into what the system that we're about to install is going to do for us. For people who don't know, the city procurement process is such that the council members can't know anything from the time the RFI goes out until a vendor selection has been made, and then the staff brings to us the proposed contract, and I suspect an overview of the specifications of the system that has been selected, as well as a rollout plan. So we'll know a lot more in a bit. And what I would really like to ask is not anything about that selection process, because I believe in the cone of silence and the security of that process. But I'd like to know how much longer, because it's, you know, we've had the responses for a while. I know what the deadline was for getting those. I don't know now, but I mean, it was known. And so y'all went through a vendor selection process. When are we going to know?
I'm going to be bold and probably say within 30 days.
Oh, thank you.
You know, you have a little bit of margin, but we are extremely close to finalizing. So at that point, it'll probably get down to timing with council meetings and so forth.
Thank you.
And part of it, to kind of give clarity on the purchasing process, we go through and we make a selection, then it's working through the details, and then there's a significant amount of time actually in the contracting piece and working the contracting language, which is, and again, to your point, I don't even know, because I'm not in the cone of silence, but so, you know, sometimes you'll spend a good month or two just on the legal work and the contracts.
Yeah, and I understand it. I understand that, and I'm almost like hoping we're there, you know, that we're just dotting i's and crossing t's at this point. So that's what I wanted to know. Thank you.
Any other comments? Okay, let's take a 5-minute break.
Thank you for your time tonight.
Thank you, great presentation, it's
Well,
exciting.
One of the sort of the question in the council memo was if there was a direction really from city council to proceed with preparing an ordinance for the opt-out program. And so that would be something we bring back to you in an ordinance form for a, you know, final review and approval.
Does somebody want to make that motion?
I'll move to direct staff to proceed preparing an ordinance establishing an AMI electric meter opt-out program as presented.
Thank you. Second.
All right, the motion was made by Councilwoman Susie Hidalgo-Fahring and seconded by Councilwoman Martin. Let's vote. Did you find it?
No. I can't push that button unless I'm looking at it. If you can verbalize your vote, I can record the others and not have to vote. Aye.
Okay, motion carried.
And
Thank you.
thank you very much for that. We'll proceed with it. And I do want to thank Mike tonight and Rick Schmidt in the background, and a very large team with LPC employees that have really brought us to this point and have been working on this AMI program and the contract diligently for quite some time. So, thank you.
Great presentation. Thank all of you for your time. Can't wait to get this started.
Thank you.
Okay, we'll take a 5-minute break and then come back for the Longmont Housing Authority. Okay, before we adjourn and re-adjourn as the Longmont Housing Authority, do we have any mayor and council comments? Seeing none. City attorney is gone. Where is he? Eugene, no comments? He disappeared. City manager Harold?
No comments,
No
Mayor.
comments, Ben. Okay, can I have a motion to adjourn as Longmont City Council and convene as the Longmont Housing Authority Board of Commissions? So moved. All right, it's been moved by Councilwoman Martin and seconded by Councilor Waters. All those in favor? Was it? Okay. That motion carried. So now we are in the Longmont Housing Authority Board of Commissioners meeting. I don't have anything else on here.
I have,
Oh, here we go. Do we need to do a call to order on this? All right, Dawn?
Roll call.
Yes.
Chairperson Peck,
Here.
Commissioner Waters.
Commissioner.
Commissioner Martin. Here. Commissioner Hidalgo-Fahring.
Here.
Commissioner Rodriguez.
Here.
Commissioner Yarbrough. Here. Chair Peck, you have a quorum.
Thank you. Dawn, do we have any agenda revisions or submissions of documents?
Yes, there were revised materials for item 5A that I emailed to council and added to the web Monday afternoon at 2:30.
Okay.
They were revised budget documents.
All right, thank you. Do we have a motion to approve the minutes of October 19th?
So moved.
It's been moved by Councilwoman Susie Hidalgo-Fahring and seconded by Mayor Pro Tem Rodriguez. Vice Chair, and not Councilwoman, Commissioner. All those in favor, let's vote. Okay, that motion carried unanimously. Do we have any public to be invited to be heard? I don't see anyone that has signed up. So seeing no one, we will move on to new business, a review and approval of the 2022 property and agency budgets.
Commissioners, thanks for allowing us to go over the budget today. I do want to, for everyone, do an introduction of the team that we have working on the Housing Authority work. So Kathy Fedler, Karen Roney, Lisa Gallinar, Molly O'Donnell, and then Kendra Daniels is not able to join us tonight. Kendra's part of our finance crew and my partner in crime in the budget and working through some of the financial issues. So we did provide an update to you all, and as I start the presentation, one of the things that happened, and I'll really focus on it when we get into those budgets in question, this will match the information that you all have in your packets. It'll look a little bit different. But when we were working the expense budget, just so you know, we had the expenses for the positions that were within the city. So we're talking about the accountants and the IT piece, and we actually separated that so it'd be easier for us to manage. In the roll-up sheets that sent to you, it was specific to a cell and didn't roll up in the way that we needed to. Kendra caught that when we were working on the variances for this presentation, and that was the amended piece, and I'll get into specific details. One of the things that's going to be a little bit different, and so obviously last year when we went into the budget process, we were still learning about the properties and who had what property. Tonight's budget presentation for you all is only going to focus on the properties that are specifically associated with the Longmont Housing Authority. There are properties in the system that are actually under the purview of Longmont Housing Development Corporation. So last year you saw every property. This year, you will not see the Lodge and Hearthstone, Spring Creek and Fall River. I have those to go over the numbers, but in terms of voting on the budget, you will not vote on Village Place, Spring Creek, Fall River, or the Lodge and Hearthstone, because those properties are actually technically under the jurisdiction of the Longmont Housing Development Corporation. Last year, I think we were still learning, and we gave everyone everything, both on LHDC and LHA, and so I wanted to point that out in case you asked the question. Once we get through this budget process, I will then give you a quick overview of what those properties look like and talk a little bit about the work that we have coming forward with the Longmont Housing Development Corporation. So we're going to start off today. There wasn't an amendment to the Aspen Meadow campus, and if you look to the left of this chart, we're going to really talk about Aspen Meadow Senior Apartments. As you all know, that was a property that recently went through resyndication, and you're going to hear me talk about that property when we get into the LHA General Fund budget, because revenue does come into play into the general fund from this project. I'm going to talk about a few things on this one as we start out. So when we look at administrative expenses and we look at the variance, and actually Commissioner Yarbrough asked me this question earlier. She does have experience in housing authorities, and we were talking about how to think of these properties. And it probably, I'm going to back up a little bit, is a good idea for me to also to give you all sort of another grounding in this, because I had to realize it too. In the current structure, you have LHA and you have LHDC. And each one of these properties have their own budget line item with it. So Aspen Meadows Senior will have its own, Aspen Meadows Neighborhood will have its own. And what's different in this is that some of those properties are within the LHA structure, some are within the LHDC, and I'm going to talk about where we're probably going to, well, where LHDC wants us to go. In housing authorities that typically have the development component with them, sometimes what you'll see is a general, here's our property and development budget, or a property management budget and a development budget with sub-accounts in it. Each one of these, in our case, is its own account as we're going through this. When we look at the Aspen Meadow Senior Apartment and we look at the admin expenses, so generally what you're going to see in each one of the admin lines in terms of raising the cost is one, when we benchmark the salaries, as we talked about when we took over the housing authority, we're going to benchmark the positions like we benchmark the positions for the rest of the city. So in that, you're going to see the benchmark adjustments for the property manager and for the maintenance person associated with that property. In addition, and you're going to see that in every one of these property budgets. In addition, what you're going to see in that number is we had to rebid our landscaping and our snow removal for these properties. And so we were not, as you all remember last year during the storms, we actually had to cover that with the city. And so we rebid the project this year so that we could actually bring in a higher level of landscaping services and snow removal in this. So you will see that. And then in some of the properties, we also had insurance increases come into play, and where you'll really see that show itself in a more significant way is the suites. And so that's what's embedded in these cases. We're also, in terms of health insurance, having to absorb more. We were at 2019, we're moving into 2021. And then what you also saw in this is the finance activities, and so this is another one of those components that we're straightening into the future is we're including the full mortgage payment to make sure we have enough cash on hand to carry the liability amounts with each one of these properties. So in terms of Aspen Meadow Senior Apartments, you will see that we're bringing in $573,000 in revenue, $527,000 in expenses, with a net income of $45,000. We have to also fund the reserve replacement each year for these properties, and so that's 3% of the amount. So you're seeing 3% of, Kendra can answer this question, but 3%. And so we have to also put that into 15,000. That is available funding for when we have issues at the property. So if you'll remember, we talked before in the budgets where the maintenance budgets were getting out of alignment and they were overspending. It's because when things went wrong, they weren't utilizing the replacement reserve. They were actually just putting it in the maintenance account. So when boilers go out, we go to the replacement reserve in this, and we're required to do that by CHAFA. So then at the end of the day, when we take the reserve replacement, we're coming in with 45,000 in net income, backing out the reserve replacement of 15, which leaves us 30,000 in net income. Again, if you remember the past budgets, we were, I think, in the red on this one, or a few of them. Aspen Meadows neighborhood, again, a smaller budget when we look at the admin expenses, and we are adding some in tenant services. We did talk about that, so we can hopefully do a little bit more for the residents. So when you look at the Aspen Meadows neighborhood budget, you're seeing 365,000 in total revenue. You can see that the admin expense isn't the same as Aspen Meadows apartments, just because there's a shared responsibility in management and maintenance. Utilities are going up across the board. I forgot to mention this earlier. As you all remember, we've increased utility rates, we've increased stormwater rates, and so those are things that we have to absorb. I will touch on that when it gets to the LHDC properties. Again, we are seeing increases in maintenance and operation based on our spending pattern. In this category, you can see that our expenses are 305,000 with the net income of 59,000, funding the replacement reserve on this one of 10,000, leaving a net income on the apartments of 49,161. The suites. So when we talk about the suites, so this was interesting. This was interesting too. So I will start off. I've already talked to you all about the bringing everyone to market, the insurance adjustments. The insurance showed itself in this one in a different way. So on the suites, the increased insurance was we had a 125% loss ratio, and so we talked to you all about the impact of the meth units on these facilities. So obviously our loss ratio was high, so the cost went up. But then we also have a requirement in the loan docs to carry a $25,000 deductible for wind and hail. And so we actually had to come in and purchase a buyback policy so that we could meet the requirements of our loan docs. And that insurance cost was an additional $20,000 that we had to absorb in this. And we worked with Doug in risk management trying to figure out different ways, and we really just couldn't move through this. One of the things that you're not seeing is the same increases on the administrative expense side. So when we talk about moving to market and those issues, all of those came into play here. But one of the things that occurred is when we looked at hiring a supportive services position. So last year we had that fully into the suites budget. We were actually able, HUD approved us to bring that half of that position into the lodge in Hearthstone for support services work, and so we were able to split those costs, and therefore we didn't see the same increase in that administrative expense line item. You do see more in tenant services in this than you do see in others. That's because the property itself does require supportive services versus the others don't. And so we have to provide that for our residents. For example, one of the things that we had to provide is television service. And so another reason you'll see the number go down is we worked and partnered with Nextlight and Streamwise. And so what we were able to do is come in and essentially put a commercial grade antenna so folks could get the over-the-air channels. We were then able to save $30,000 in terms of our Comcast expense. If you remember, we did create a bulk contract for internet services, and so we're working with folks in order to look at how they can stream to augment that. So we were able to save money, put more into tenant services, but create a similar experience in terms of the TV services we provided without the cost that we had historically had in this. And I'm going to stop here once I get through this because I can see potentially some questions. And before I get too far down the road, I want to answer those. So when you look at this, the budget for the suites, obviously $1,066,000. Expenses $1,002,201. Again, bringing the net incomes lower on this one than it was last year of $68,000. The replacement reserve, based on where we're setting in this case, is only 1,400. Well, that's not right. I've got to look. Or no. So we have the 1,000 and then the net income or 51,000, sorry. I can't see. 51,000, so a net income difference of 12,392. I guess I need other glasses now too. I'm going to stop with these 3 properties to see if there's any questions that you all have on these budgets thus far.
Commissioner Martin?
Thank you, Chair Peck. Just a quick one. On the net loss, $70,000 on the suites. What do you do about that? I mean, you can't get more income out of the property.
No, we have a net income of 63. We fund the reserve at 51,000, and then we have a net income of 12,000. The net income difference is from 2021 to 2022 in this. And the difference is in 2021, we didn't fund the replacement reserves. Again, we were still trying to figure this out.
Okay.
And so now this is a good question. When we say we're putting it into the replacement reserves, it is usable dollars for us on the properties when things break and go wrong. And so it's not like we're just holding it there and we can't use it. You're used to that more in our budget system. It is designed to replace roofs, air conditions, boilers, all of those things. And that's a bit of a difference in terms of really making sure we're budgeting appropriately.
So the insurance gap that you mentioned, which scared me, and that's why I was seeing negative numbers,
Right.
Is resolved, and you are in the black on the suites just barely.
Correct.
Okay.
Well, we're in the black 63,000, but we're putting 51,000 of that into the replacement reserve that can be utilized by that property.
Right. Okay. Yeah. Thank you.
Commissioner Waters?
Thanks. Chair Peck. Harold, it would be good, not tonight, but to come back, an email, just to give us an idea or be more specific. The 3% is 3% of what, right? Like on Aspen Meadows, 15,000 and 3% of 500,000, right? I mean,
Right.
I don't know where the 500,000, where would I look to see the 500,000 or what we're calibrating? And so across the board, right? So you have some idea what that anchors to, number one.
Mm-hmm.
Number two, I get tenant services here because we're obligated to supportive services. But for like Aspen Meadows or any of the other properties, when we see tenant services, give me a better idea of what tenants should expect or we should expect if we're interacting with tenants as the use of those resources in the interest or service to tenants.
Tenant services can be anything from earplugs when we're doing the fire alarm testing to help them, supplies for potlucks, supplies for the coffee and conversations, holiday meals, anything like
Community activities.
Right.
Got it.
Community.
Thanks.
So in part of it, so what we learned today in the advisory board meeting is that we learned different groups. And so today, Lisa in the conversation, they said, well, we come in and we pitch in for coffee and things. And Lisa's like, well, talk to me about that because we can do that.
Yeah. That's helpful to know.
Yeah. And at least, and Kendra gave me the answer this morning, and I just dropped it. When I mentioned 3%, I just dropped the other piece of it. So we'll have that to you all. So Briarwood. So Briarwood Campus, just so for those as a refresh in terms of the location, Briarwood is on Main Street, just off of Mountain View, and so it is the facility that we contracted with the Veterans Community Project in terms of their office location for the office. We do have the units in the back of that location, of which we still own and manage as the housing authority. So once again, we did have a change in allocation of where employees are budgeted. One of the things we're going to have to do in this is we're also going to probably eventually have to bring a management agreement between Briarwood Office and Briarwood Apartments because of the lease to the Veterans Community Project. We also had a similar change in cable service at this location. And then we had a change in allocation of the utilities. So the Veterans Community Projects pays 40% of the utilities. Briarwood Apartments pays 60% of the utilities. So that's why you see some of the decreases in this budget, just because of that arrangement and the revenue we're bringing in. This finance currently includes the full mortgage payment to make sure we have enough cash on hand to carry the liability amounts. And so in terms of the apartment, you can see that $116,000 in revenue, $51,000 in expenses, $64,000 in net income. We don't have the reserve replacement requirement in this situation, so we are pulling that net income of $64,000. So you're seeing a $58,000 difference in the net income at Briarwood. If you all remember last year, this is one we were really struggling to balance and that really is a big part of the savings that we've seen with the agreement with the VCP, Veterans Community Project. In terms of the Briarwood office, we're seeing a revenue reduction in this one because the HCV component in the budget was paying into the office, which was then part of the Housing Authority's general fund in terms of the overall expenses. This is the revenue we're bringing in. Again, not a lot of expenses associated in this, but we still are bringing in components that we talked about. So you have the total revenue of $26,000, expenses of $25,000 with a net income of $978,000. In addition, on this office component, we are going to have to work with our facilities group to get an operational cost per square foot on where folks are sitting in our building, so that HCV can pay appropriately the funds we have on the Housing Choice Voucher program. They can pay appropriately into the office, into that account. So we're accounting for the expense associated with the office space. 615 Main Street. This is the building with the Center for People with Disabilities. Again, as you can see, fairly consistent in terms of what we saw last year in the budget. The $24,000, almost $25,000 in revenue, $17,000 in expenses, with a net income of $6,894. Again, using the same allocation method in this budget line item. This is going to be an interesting discussion. This is going to be a discussion we're going to have to talk about as we move forward. So 615 Main was associated with, and even as recent as today, Kendra and I had another question of, does it really go to the LHA or does it go to LHDC? And I'll explain why. 615 Main Street is associated with the Village Place Apartments, which is a property that's owned by the LHDC. And so when we go into resyndication to bring Village Place into the LHA portfolio, we're already in discussions now trying to figure out how we can potentially disconnect 615 Main Street from Village Place in terms of options that we have. We know that the current tenant is interested in potentially purchasing the building. We're really just going to have to evaluate how that's going to work and what makes the most sense for the Housing Authority, the community, and that will be something we're going to bring back to you all to talk about. Have I missed anything? Sunset Land. So this is the land adjacent to the suites. If you'll recall, part of the land the city purchased in terms of trying to finish out the financing for Fall River. And so you're seeing we need to use fund balance on this because we don't have anything developed there. So we're using fund balance of $6,500 with the expense, and this is the maintenance and operations. Again, you're seeing the landscaping contract. We are going to work on the landscaping contract to see what we actually have to do. I don't know if we finished that, but I know we were asking some questions on this. This really is also going to be connected to, Kathy, am I correct, in the Element project and what we're looking in the development of the additional fully supportive housing at the Suites location. So similar to what you saw in AMSA, if we can get that project moving through, development revenues will come forward to both benefit this specific section, also benefit the Housing Authority General Fund. So now to HCV, and this is where you're going to see the formula error show itself. So the first one is just the housing choice voucher. So this is a pretty, the budget on the left is a pretty straightforward budget. We have 5.4 million come in. We have 1,000 in admin expenses associated with that, but then 5.3 million is what we put out in the housing assistant payments, or the voucher dollars themselves. So this is really pretty much a pure pass-through via the voucher numbers. When we look at the administrative component of this, so on the one that you all received, you didn't see, it's not as drastic a difference in this one. So we had 287,323.22 in the original, and now it's $302,027.45, and that really is this budget's portion of the accounting staff and the ETS staff. Again, in the future, when we kind of talk about the maintenance and operations general, that's where we have to figure out on the expense side of what that really looks like in terms of paying for office space. So the total expense at this point is $302,000. We're bringing, that then creates $69,084 in net income as we're looking to the future. This actually does also provide us, I think, a little bit of cushion if we need it in terms of, if we see rental increases. I guess we could use it to cover, Kathy, on the other side of it if we get out of balance on the voucher side, correct? So this has to stay in the administration and the expenses of the voucher piece. So single room occupancy, Kathy, I forgot I just lost it again. What single room? Oh, so this is the in-between piece in terms of, and it's a voucher program as well, correct? To the in-between. So you're seeing 76,000 there. Again, most of it is directly similar to the HCV piece of 57,000 in payments. Total expenses of 68,000 on the single room occupancy, with a net income of 7,469. Again, this was another one where we had to allocate some of the accounting and information technology cost. And so the original number that you all received was 9,651. It went up to 10,940. And again, that's just the straight allocation of those costs. Now, where you're going to see the big jump is really in the LHA General Fund. And so what you saw on the original budget was $1,060,000 in 2021, $600,000 in 2022, with an admin expense line of $464,000. Again, the bulk of the accounting cost and the information technology cost goes to the Housing Authority General Fund. And so the actual expense is $826,478, with an administrative increase of $100,756. Again, the bulk of the positions are in this line item, so you're seeing the market rate adjustments for the positions here. You're also seeing where we talked about earlier in the HCV program, where we had an HCV program manager, and we had 100% of that cost budgeted. We know we need compliance, If there's one thing that's come out in all of this is we need compliance. And so what we did is we're actually going to create a dual position of an HCV manager and a compliance position. And so this budget had to assume 50% of that compliance cost because you're not allowed to pay for that out of the HCV funds. And so that added to the overage in this compared to where we were last year. Now, I want to talk a little bit about the revenue piece in this because and we've really got to figure out terminology. I know we talk a lot about terminology. So in this, you see fund balance needed and then other revenues. So the other revenue is really a combination of things coming in. That's the management fees that we get paid from LHDC, the management fees that we get paid from each one of the individual property units. But what happened in this revenue piece is that you all have heard me talk about how development funds the operational cost of the Longmont Housing Authority General Fund. And if you remember when we talked about where things started sliding, it really was related to the fact of once we kind of got through Fall River, there wasn't development, and so there wasn't revenue coming in. So when Kendra and I were working on this budget, one of the things that we saw is that we were projecting, instead of 600,000 there, we were projecting 950,000. And that was because we were estimating a 350,000 payment associated with the Aspen Meadow Senior Apartments financial deal coming in 22. We then were notified about, a month ago? That's actually going to come in 21. That's still operational dollars that we're bringing in, so we couldn't put it in that other revenue line item. It's going into their fund balance or their net income component of this. So then we're saying, and this is a conservative number right now, that we think in terms of the fund balance that we have in play in terms of total revenue is 600,000. We need to get out and close the year out on this one. We think, based on what we're seeing, it's probably going to be closer to 750,000. So then at the end of the day, when you look at the expenses of we have 1.2 million in revenue, 852,000 in total expenses. That creates for the general fund a net income of 347,000. Based on where we're seeing that piece, based on where we're seeing the fund right now, and again, 600,000 is conservative. We didn't want to be too aggressive because we've run into some nuances on the LHDC side that we've had to really work with accountants on, but we think we're probably going to see another 150,000. So we think we're probably, we have the likelihood of being at a net income of approximately $490,000 in the LHA General Fund. Now, the key lesson in this is, what are we trying to do? So when we look at the admin expenses, there's $100,000 in the line item detail on this for consultant services. And so what we're talking about there is, if you'll remember, when we were trying to learn this, we brought in AH Forward, which was a specialist in this world, and then we also brought in Yardi Consultants, where they were specialists on the operating system. We don't know how much we're going to need them this year. We know we're probably going to need them, but not as much as last year. So we wanted to leave that 100,000 in consulting services for this year. We think we're probably going to bite down over it on time. So that's a piece on this. What we're trying to do in terms of the operational expenses is really take ongoing revenue to make sure we can line those out moving forward and not be so reliant on the development revenue that comes in on re-syndication or developing new properties, because it will make it easier for us to budget on an ongoing basis. So that's what we're seeing on the expense side. The other thing that we still have to finalize is a deal with Chrisman for Chrisman 2 and Chrisman 1. We couldn't put that in the revenue line item because it's not finalized, but at least based on where we are today, we know that'll also increase revenue. And so when you look at the difference between the ongoing revenue and the ongoing expenses, what we're really trying to do with all of these adjustments is really cover that with as much ongoing revenue as we possibly can. One of the things we're also challenged with, well, we're still trying to make up ground, is rents were never set where they needed to be over time. And so we're going through that piece as well to increase the revenue stream. And then obviously we've set some target goals, and you'll see in the detail where different properties, we have different vacancy rates that we're using to budget. So we've set some pretty aggressive goals operationally for Lisa. There are some properties, for example, the suites, where it's not the same just because of what we're seeing on an actual basis. But we are basing on that on what we're seeing real time. All right. Kathy found the answer.
So the replacement reserve is based on a per unit per month contribution into that, and it ranges from 300 per unit to 400 per unit from what I can tell. And I think that's based on the size of the property and how new it is. The 3% is an increase annually. You should add 3% each year to what you're setting aside per unit per month.
Did that answer?
So the number, the 15,000, or whatever the number we're seeing, is a result of that calculation of the revenue per unit or the charge per unit adds up to X. The 3% is what you would see to increase year over year, both in terms of the per unit contribution and the total. Is that it?
Correct. And so now we've got to figure out what's the formula to get to you on how that's calculated.
Yeah, got it. Thanks. Thanks, Ken.
So that is the LHA budget that we need to approve. So so now we've gone over the remaining line items. Would be happy to answer any questions that you all have on this.
Commissioner Yarbrough.
I thank you so much, Chair Peck. Thank you. There is so many questions that I have that we can't go through them tonight. I would like to ask that I have a separate time to go over this budget because it's so confusing for me compared to my background in the housing authority. And I know we talked earlier about it and found out I wasn't crazy about why I was confused. I may be still crazy, but so I have so many questions to ask and definitely want to sit down with someone in the housing, to go over each property and the differences between the housing authority and the development, all of that. That's the difference, and that's why everything was so confusing for me when I was reading the budget. So I just wanted to say that because I do need more clarification on the budget and understanding for me, in order for me to definitely make a decision. So I hope that's not an issue. Does that make sense? Or
Yeah, I think do we need it from a timing perspective? Yeah, we'll need a vote by the end of the year, so we can definitely answer questions and then bring it back if we need to do that.
okay. I hate that I don't want to hold up anything, but it's just for me, myself. I know I'm new, and I know the commission, the commissioners have already reviewed everything, and I don't know how this works, so I'm learning. So I don't know if you all agree with the budget and I just learn later. I don't know how that works. So I guess I'm asking a question and then also making a statement, so if anybody want to comment.
So let me just ask Kathy, you said we can hold off on this budget until the end of the year? or do we need to pass it tonight?
Well, we'll need to do it in December, I
Okay.
think, you know, so options that Kathy just, I mean, Commissioner Yarbrough can abstain from this, and we can move forward, we can meet with her and bring it back at a later date. I mean, those are all options that we can do on this, but I don't know if there's other questions on the Housing Authority budget.
Right, would anyone else like to have, be part of the explanation, to sit in on that and have it explained in further detail? Is there anyone else on this? Did you turn on your mic? Commissioner Martin.
Yeah, I didn't know I needed to talk. I would like to sit in on a further explanation because I also, I can't translate the budget line items into a structural process that would make sense to me. So I need to go to know where the money goes. And I see Aren nodding like, yeah, that's a valid question, you know, so I would like the same thing. I would like to have a session on it.
So here's a question for you, since there seems to be three of us, and I would sit in on it too. Could we have a special session to do this just for, I guess it would be 7-on-1?
Well, we could, I mean, we could set a special Housing Authority meeting on this. I think it would help to get some clarity on what specifically the questions are, because that would help too, because I think it's going to be a little bit different, but.
Okay. So perhaps the questions that we have, we could email to you beforehand. And that'll make it easier and faster, more concise session. So can I have a motion to?
Well,
Okay,
and
go
I
ahead.
want to also, did you all on the packet?
It is in there.
Yeah, and it,
Okay.
so on that one, I guess the way I would say maybe this will help. So each column is each one of these general summaries that we gave you all. And within that, there is the detailed line items, expenses associated with that for each one of these separate budgets that we
Okay.
have within the Housing Authority.
So should we have a motion then to postpone the, what are we doing here? To approve the budget until we have the educational session, I guess, on the budget.
Well, it'll have to be a regular session on this, so we do both answer the questions and vote on it. So we will have to vote on it in December.
Okay. All right, so then can we have a motion to postpone voting on adopting the budget until the first regular session in December?
So moved. Second.
All right. That motion has been moved by Commissioner Martin and seconded by Commissioner Hidalgo-Fahring. Can we vote? Okay, let's vote. Did everybody vote except for Shiquita? Okay, so that carried with 5-1 with Commissioner Tim Waters against.
Are there any more questions on this part of the budget in terms of what we need or anything that we can use to prepare for the next meeting?
I don't think so. I don't see any questions or comments.
Okay.
So the next thing is the resolution.
So I want to kind of show you some other budgets
Oh,
in this.
great.
Sorry.
Okay, no
So
problem.
this is the LHDC piece, and so here's where you're seeing Fall River and Spring Creek. Again, a very similar look at this. And so these are newer properties, so you're definitely seeing, and larger properties. So you're seeing very similar components coming in. You do have larger net incomes in this as well because of where the rent's set. So generally, again, Fall River, 56,000, staying pretty consistent in net income. The net income in Spring Creek's actually going up based on how we looked at some of the allocations. Again, this is an LHDC property. The term on this one's much longer, and so that's going to be something that, in terms of conversion to LHA, I think we have probably, what, another 12 years? 10 years? Between 10 and 12 years in terms of resyndication. The Lodge at Hover Crossing and the Hearthstone at Hover Crossing, those are LHDC properties as well. Again, now this is the one where, in terms of some of the utility fees, we're going to have to figure out how we manage this, because this is a HUD 202 property, and this is where HUD basically gives you a budget and they say this is what we're going to pay. And so when we had to submit that to HUD, I think we talked to you all about this. We didn't have some of the stormwater numbers in there, and so we're going to have to figure a gap model or how to fill the gap for this year so we can build that into the HUD process. Now, the Lodge and Hearthstone are interesting because we've also talked about the complexities of a HUD 202 property and the fact that we need to actually we want to move this from a 202 to more of a voucher, is that the right word? Project-based voucher property that reduces a lot of the challenges that we have with the 202 property. And we did talk to the LHDC board, and they were, I guess, supportive of us moving in that direction and removing it from a HUD 202 property. In that section of moving from the 202 to a project-based voucher, that is an opportunity that we're looking at, whether in terms of whether we can convert that to an LHA property. LHDC to LHA when we move from a 202.
It will automatically go into the housing-based voucher program.
Right, so it becomes an LHA property. Village Place is going into resyndication in the, we're targeting mid-2022. That will also be a point where that will be converted into an LHA property. As you saw me talk about the additional revenues coming into the Lha General Fund, it's incredibly important that we stay on timeline with this resyndication on this property, because that's going to add additional revenue to the Housing Authority General Fund components on this. And then finally we have the Hover land, which is the vacant land across from the Lodge and Hearthstone that's owned by LHDC. That is one of the parcels that we're looking at in terms of development for additional units that we talked to the City Council about during the goal setting session there. So again, that's another project that we need to move forward in terms of bringing that development revenue into both LHDC and LHA as we're looking to the future. But again, these are properties that are under the purview of LHDC. We did talk to the LHDC board. They did give us direction to look at basically merging LHDC into LHA. And so we're going to start that work. That's probably going to take about a year, we think, in order to fully get through that. And it's because of the nuances of each one of these properties and how you move through it. Any questions on that? Okay. The one thing we would appreciate is any specific questions about the budgets coming to us, so that we can prepare for what we're trying to explain. I think that that's going to be really important in terms of what do we need to dig into from you all as we're getting ready for that meeting.
Okay.
That's
Is that it? Well, no, the resolution has not been postponed.
No.
So, yeah, the next thing is the resolution on LHA 2021-09, a resolution adopting designated city policies and procedures to govern Longmont Housing Authority and its employees. So it looks like you have a presentation.
I'm just going to go over this a little bit, if I can, Chair Peck.
Sure,
And
please.
sitting over here, I can't see this side of the dais, so I thought I would stand up. So Karen Roney with the Community Services Department. So I think briefly, and then if there are other questions that you would like to ask to go into more detail, I'm happy to do that. But one of the things that we have been doing this year, once we, as we continued our management work with the Longmont Housing Authority, is to look for ways that we could streamline processes, we could become more efficient in our operations. And so, as you know, the mid-year this year, we did bring the Housing Authority admin staff over to the Longmont Civic Center and rented out the former offices to the Veterans Community Project. So that really helped us with some of our efficiencies and our ability to work together and share some staff resources. We also, the latter part of the summer, we added the Longmont Housing Authority staff to the city's basically medical, dental, and vision plans. So that, so basically for the same amount of money that it was costing the LHA employees, they were able to join our city plan and get a more robust level of benefit and health insurance coverage for that. So since that time, we've really been looking at what are other ways that we could, where were there opportunities for city policies maybe to be adopted by the Longmont Housing Authority, so that for those of us that are wearing a couple of hats, which are many of us here tonight, it's like which rules that apply here. And so we did go through and did an examination of really the policies and which ones that we thought that the Housing Authority might be able to adopt, the city policies. So that's in the handout that was in your packet that went through kind of an analysis and some of the recommendations. I can go into more detail if you wish, but I'm going to go to the resolution and really talk about. So basically tonight, what we are recommending and asking the Board of Commissioners to consider is basically for the Longmont Housing Authority to adopt the city's information technology and teleworking policies. Back about a year ago, the Housing Authority already did move on to the city's network, and so most of those policies were already operating, but we're through the teleworking policy into the mix too. And then what we are recommending is for the Longmont Housing Authority to adopt the City of Longmont personnel rules and administrative regulations with some exceptions. And I want to go into those exceptions at this point in time. The exception is that the Longmont Housing Authority staff will remain in para rather than transferring to the city's GURP or an MOPC participation. And the primary reason for that is that the penalty for the Housing Authority staff to leave para and come into the city's retirement pension, if you will, was a pretty significant hit for those employees. And given that we don't know really necessarily what the long-term structure for the LHA will be, whether after the next, I don't know, we're still figuring things out, but after the next several years, we might, if one of the opportunities is that we decide that it might make more sense for the LHA to resume its independent status rather than fully incorporate into the City of Longmont structure, that would be the Housing Authority staff members could not remain in the city's pension plan if they moved over, and then they would have to go back into para, and then they would basically start all over with their, with their terms of service. So we just felt like it probably made more sense right now for the Housing Authority staff to remain in para and not join the city's pension program, if you will. So the other exception has to do with workers' compensation, and at this point in time, the recommendation is, and from our risk management staff, was for the LHA to continue to retain its workers' compensation insurance through Pinnacle, because LHA is not paying into the city's workers' compensation program at this point in time, and we felt like we just would continue to keep that separate.
Well, and we're self-funded on the city side, so bringing it into a self-funded program versus where they're fully funded is a different issue.
Right. So that is a recommended exception. The third exception is basically with for the LHA to, and this primarily applies to the maintenance staff that are responsible for helping to maintain the properties. And it seems like they're always called out. So there's always something that needs to be attended to, but it seemed like that the on-call policies for the maintenance staff for LHA, that what we have in place for them at this point in time probably makes sense for them to retain that. And the differences really have to do with the minimum amount of on-call pay for minimum call-out, which would be, I think, 30 minutes for the city's policy, and that's not so. And that doesn't make a whole lot of sense for the Longmont Housing Authority, and it really has to do with the kind of the type of call-out, maintenance call-out is really different, I think, from the City of Longmont organization compared to mostly the residential properties at the Housing Authority. And then the final exemption that we would say at this point in time really has to do with FMLA. So right now, the Longmont Housing Authority isn't large enough, so it's less than 50 employees. So even though it could be covered by FMLA, it doesn't meet the threshold for the number of employees. And so we recommend that that the LHA continues with it. It has a couple of policies right now in terms of parental leave, paid parental leave, and non-paid medical leave of absence. And so our recommendation is that those two policies stay in place at least through 2022. There is a new state law that was passed, and don't ask me what it is exactly, but it's, well, I have it in here actually. And so so there was the state did, and hang on just a second, I'm gonna, so there is basically the state is looking at establishing a statewide system for family leave, and at this point in time in 2022, the state will be really figuring out all the details for that, and to go into effect in 2023. And what our HR staff recommended is that we look at this again in later in 2022 and see what the state has put together in terms of a family leave policy. So what we would be recommending is for the Board of Commissioners to adopt Resolution 2021-09 that basically adopts the city's personnel rules and admin regs with the exception of those that I have identified that's on the resolution. and be happy to answer any questions that you might have.
Commissioner Hidalgo-Fahring?
Thank you, Chair. So I do have a question on the parental and medical leave of absence. I know under FMLA, an employee's, their employment status is protected. With what LHA is doing, is there still that same protection for employees who take a leave of absence?
Yes, that would still, that would still apply. So they would get, again, they would get that authorized leave.
Okay.
Medical leave of absence, and then they also have paid parental leave. So by having authorized leave, then they would have their employment
Their
would be
employment, okay.
protected.
Very good, thank you.
Commissioner Waters? Nope. Do you want to log in again? There you go.
Thank you, Chairwoman Peck. Karen, we didn't have a resolution. Did you know that in our packet?
No, we didn't get it. Well, it says there's an attachment, but I can't open it.
Yeah, I just didn't know if you knew that. We didn't.
Well, I did not know that.
No, I appreciate, the 4 areas of exception and
Is
the
it
rest
in
of the rules applying, just so you know. I trust your work. You ought to know we didn't have a resolution in here to look at tonight.
So is it,
Chairperson Peck, if I might, if you look at your live meeting and you look at item 11, right underneath is the attachment of the full LHA packet.
Where?
And it's.
I'm sorry. Item 11?
Under item 11.
Got it?
The first paperclip is the full LHA packet of items. And then there's about 6 or 8 attachments. And that are numbered in the same order as the agenda.
There it is. It is in here.
It is
just
there,
is
yes.
hard. It's not easy to find. Thank
No,
you.
it's convoluted.
we keep trying to make this work.
So can you give us another 10 minutes to read this? No, I'm just kidding.
The resolution is fairly brief.
It is very brief. Thank you. Do I have a motion? Somebody want to make that motion?
I'll move resolution 2021-9.
Second.
It's been moved by Commissioner Waters and seconded by Commissioner Hidalgo-Fahring. Let's vote. Yay. So that passed, carried 6-0.
Thank you.
So we have an interim executive director report. Harold, do you have an update on operations, or did you?
I was gonna have Lisa go over the vacancy,
Okay.
and property updates.
Thanks, Karen. Including your packet, you should have the LHA occupancy and availability report. We ended October at 95% occupied for all the properties. We have 24 available units to rent, and then we have the 2 units down that are due to meth. Do we have any questions in regards to the occupancy or vacancy?
I do have a question. I think I just answered it by looking at this. But thank you anyway. Anybody else have a question? Seeing no other questions, are we going to have this is the property updates and the vacancy update.
So then I have the property updates.
Okay.
To just go over a few from the last few months, we have hired Melinda Saracino, who is our resident resource specialist for the residents of the Suites, the Hearthstone, and the Lodge. We've hired Sanderson, who is the new manager at Village Place Apartments. We currently have a maintenance position open and an assistant manager position open, and we will have a second maintenance position open shortly.
Great.
The Suites, currently, we are holding weekly COVID testing due to increased numbers of residents with COVID. So we will continue doing that weekly until we have 2 full weeks with no new test.
And that is actually listed as it's publicly listed as a site of, what is it, outbreak? Is that what they call it?
Correct.
And so that's why we have to continue these testing protocols.
Harold, how many people at the suites have been vaccinated?
We do not have numbers on
We
those.
don't have that information. Department of Health and Boulder County Health knows that information because they're tenants. It's a slightly different issue in that world, and so it's different. So we can very clearly ask our employees whether or not they're vaccinated, but when you get into that landlord-tenant relationship, you can't.
Oh, it's too bad. Okay, is that it for the updates?
Correct.
Okay. Do we have any commissioner comments? Yes, we do. I'm sorry, I turned it off. Try again. Commissioner Martin.
Thank you, Chairwoman Peck. I have questions that there doesn't seem to be an appropriate place in this agenda for me to ask. And those questions have to do with the process operations of the LHA as opposed to the snapshot that the budget represents. So last June, I guess, at the City Council retreat, which was really mostly about LHA, we had some numbers, right? We had 3 big properties and a goal of 2,000 new units and some projects that were going to have different focuses, right? Like transitional housing and housing for young families and people aging out of foster care that we don't do right now. And there's nothing about starting those projects, but the other number was 3 years, which pretty much means those projects need to get planned and contracted out this year. So where do we talk about that and how does it happen? Because I don't know.
So so I can answer part of that, and we can put that at a future agenda item and what we do. So generally,
Thank you.
Where we are right now, so Project 1's Crispin 2. Project 2, and this is why I talked about it, where it's incredibly important, is a resyndication of Village Place, because it's going to bring in different operational dollars. It's not new units, but it's a part of bringing additional dollars into it. Location 3 is the Hover land that we talked about and how we can look at that in conjunction with ARPA funds.
Do we know how many units that's projected to be?
We've got to go into development to see what we can really bring in from a code perspective. Location 4 is the 9 acres that were associated with the property in the Costco project. And then location 5 is the remaining property that we have at the suites, of which one of them is the Element project and what we're going to do with some of the additional property that we have available there.
So I heard the Element project mentioned earlier, but I don't associate it with anything in the real world. What does it mean?
So that's a project that we talked to you all about. That's the additional fully supportive facility adjacent to the suites that I think we presented about 8 months ago or so. They actually submitted that into the state for tax credits. They didn't receive it, and they're going to resubmit in February this year, just based on what was there. And so that's the one. If you know where the suites is located, the project that we got approval on the other side, and I think we allocated some CDBG funds for that as well, affordable housing funds.
So if we never get tax credits, what happens to the project?
Then you're probably going back to the drawing board, because the only way that these affordable deals work is through that tax credit model.
And do we know why they were denied?
I think it was what we heard from the state. It was just basically, I guess to put it, we've had a lot of tax credit projects here in Longmont recently, and there were some other tax credits in other areas of the community that they felt like they needed to fund. There wasn't anything specific in terms of why.
So it wasn't our turn.
Pretty much, yeah. And tax credits are, if you go in the non-competitive tax credits, those are 4% tax credits. That's what we did in Crispin too, so that's why it was able to move through. When you go into the competitive tax credits at 9%, then that's where it becomes really, I mean, you're just not sure when you go into that project. And so it's slightly different.
Thank you.
Did I
And I
miss
would like to
anything?
see it on a future agenda.
Yeah, I was just gonna say that that particular project, if it doesn't get funded again with the 9% round, that is something that we have on the list, depending on approvals, to possibly put ARPA funds in to do the 4%, because there'll be a gap that will have to be filled to make it like a 9%. So it's possible it could still move forward, but it's gonna take more investment.
It's almost like a bridge financing model with ARPA dollars to make up the 5% gap, so you go non-competitive.
Commissioner Waters?
Thanks, Chairwoman Peck. Just maybe building a little bit on Commissioner Martin's question about goals. I know we've had that conversation, and Karen brought back, some thoughts in a meeting or two ago. When would we anticipate actually seeing an actual draft of goals and objectives for the next couple of years?
Your December meeting, we're meeting Friday as a group to kind of finish that and pull that forward.
Yeah, thanks. Just on the 9% tax credits, it's my recollection, the CHAFA gets maybe 10 proposals for every project that's awarded, or it's like a 10-to-1 ratio. Is that still consistent? So when Element submits their proposal, they're competing with projects from around the state, all of which have been really thoughtfully developed, and I just recall how competitive it is for the 9%. For the 9% tax credits. Specifically related to Village Place, not in terms of syndication, but I haven't been in the middle of conversations about parking. You have, I think, about both the circular drive and allocation of parking relative to the spoke and that parking garage. I've heard from Village Place residents about this, their concerns. Can you give us just an update of what the status of that discussion, and have the decisions been made? What's the status?
So I guess the genesis of this was there was a conversation at the DDA board meeting about their desire to see certain things in that area where the parking, and the structure in the middle of it. And from that, the conversation really took off to, here's, we're going to lose parking. I know that Kimberly did send an email out to the residents indicating that that was just part of a broader conversation. The reality for us when we're in the re-syndication is we've got to look at what are we required to park based on the original approval, what do we need for parking, and we have to answer all of those questions before we're anywhere to the point of saying that's reasonable or not reasonable. And frankly, I think there's some title work that we've got to figure out in this, because there's last I heard, property lines and some other issues in terms of who owns what. So basically the answer to the question is that stemmed from a DDA conversation. That is different than what we're working on in terms of re-syndication and what we need to do as the Housing Development Corporation and the Housing Authority.
And so the message to village-based residents is don't just kind of chill here.
Just chill,
There's
just
not much
hold
to worry
right now,
about.
because we got a lot of work to do.
Yeah, thanks.
Right, so. The only thing that I'd add, Chair Peck and Commissioners, Molly O'Donnell with Housing and Community Investment. I'd add that we are currently in the process of selecting a consultant for a capital needs assessment, including this property and others. And one of the questions that we have right off the bat is, help us with this parking question. We have conversations going on over in planning as well to talk about what we need versus what the actual demand is. It does tie to the 615 Main property because that has some of the parking attached. So we're exploring multiple routes. That's top on our list.
Thank you, Molly.
And as a side note, I realized we needed to figure it out when I parked in the wrong spot and had a welcome note on my car because I didn't know where to park. So there's a lot of work that we have to do on this one.
Are there any other comments for staff? Well, with that, can I have a motion to adjourn? So I'll second that. It's been moved by, I guess we're still Commissioners Waters and myself. Can we vote? All those in favor? All those in favor say yay. Oh, that passes 6. That, it carried. We are done. We are adjourned.